At first, good morning to everyone. I hope you hear and see me well. Today, I will give you a lecture how to improve your endodontic skills through a new shaping concept. For those who listen to me first time, I want to introduce myself. I live in Belgrade. Belgrade is the capital of Serbia, and this is a wonderful town. I hope one day the Belgrade will be on your traveling list. I work in a school of dentistry in 𝗏𝗶𝗴𝗴. We are first private university. I'm full professor. I'm specialist in restorative dentistry and endodontics, and I'm head of the Clinic of Dental Pathology and Endodontics. I'm called for Fanta Dental too, and together with my good friends and wonderful professional people from Prof and 𝗥𝗶𝗀𝗶, we have been organizing so many endodontic courses for more than 5 years, and so many colleagues, not just from Serbia, but from the region, pass through our courses and start their instrumentation with the rotary instrumentation with us and with Fanta systems. Okay, endodontic treatment is a very demanding and difficult therapeutic procedure that requires a lot of knowledge, a lot of experience, and a lot of skills. And I can say if we want to be successful in our endodontic treatment, we need to be minimally invasive. The concept of minimally invasive endodontics or philosophy prioritize preserving the maximum amount of natural tooth structure during root canal treatment to improve long-term tooth survival. And the concept has existed for more than 10 years, meaning to be minimal invasive in every steps of endodontic treatment. In today's lecture, I will pay special attention on the parts that is related to endodontics instruments. The primary goal of minimal invasive endodontic is to retain as much healthy dentin as is possible, as this strengthens the tooth and contributes to its long-term functional and survival. And the concept of pericervical dentin first appeared in the literature in 2007. And the pericervical dentin is a part of the dentin 4 millimeters above and 4 millimeters below the bone alveolar bone crest. And today in literature, we have so many evidence-based systematic review and meta-analysis, but this time I give you one new systematic review from 2024, said that based on the result of the study, there is evidence to support that pericervical dentin preservation offers fracture resistance to the endodontically treated posterior teeth. The clinical significance is the practice of conservative cavity preparation and avoiding the usage of instruments with high taper increase the fracture resistance of the tooth by retaining the pericervical dentin. The next key principle is, instead of traditional large access cavity that lead to straight line access, minimal invasive endodontics use smaller, more conservative access preparation that avoid excessive removal of tissue. We know that we have traditional access cavity, we have conventional, something like 𝗘𝗱𝗃, and we have ninja access. And many studies shown that teeth with traditional access cavity showed lower fracture strength than the ones prepared with conventional or with ninja. But ultra-conservative ninja did not increase the fracture strength of teeth compared with the conservative. And the recommendation is, please do the conservative access cavity, something like 𝗘𝗱𝗃. The appropriate shaping is very important because the aim is to clean and disinfect the root canal system while only shaping the canal of the necessary extent, avoiding over-instrumentation. And we know that the factor most related with the over-instrumentation is the taper of the file. And taper describes the increase the file diameter per millimeter from tip to handle. And we have different types of taper, like such a fixed, progressive, regressive, and variable. Regressive taper has a taper that decreased from tip to handle, but progressive increased, and variable tapers reduce the file's interaction with the canal walls. It is very important to say that so many studies in scientific literature shown that revealed endodontically treated teeth may be more resistant to fracture after minimally invasive root canal preparation, employing nickel titanium files with lesser taper than those used in the greater taper procedures. In minimal invasive endodontics, we usually use the files with variable or with I can say small fixed taper. And of course, one more key principle is to enhance chemical disinfection. Minimal invasive endodontic techniques are designed to allow the true chemical disinfection of the root canal system, and the smaller canal can be can have a good disinfection because we can use something like activation of irrigation, something like sonic, ultrasonic, or laser. We need some technological advancement enabling minimal invasive endodontics, such as improved understanding of canal anatomy, such as surgical microscope or advanced rotary instruments. With better diagnosis, with better diagnostic tools like CBCT, we can better understand the complex anatomy of the root canal system, and then we have ability to navigate and to treat them conservatively. The magnification and the surgical microscope allows a more precise and safer treatment, and the using advanced rotary instruments is necessary because we need to have flexible, controlled memory, advanced nickel titanium files, and these files are essential for shaping difficulty anatomy or, curved root canal anatomy without procedural mistakes and without the risk of fracture. And I can say only if we are minimal invasive, we can be successful. What are the benefits of minimal invasive endodontics? At first, we have increased tooth strength and survival. Second, we have more conservative treatment. And third, we have greater efficiency because by using modern instruments, techniques to reduce procedural time and risk, we promote efficiency, especially among younger practitioners. And today, I will introduce to you one new, I can say new system from Fanta Dental, and this is 𝗏𝗏𝗏. 𝗏𝗏𝗏 system is unique. 𝗏𝗏𝗏 system is powerful, and 𝗏𝗏𝗏 system is effective. You can see in this system, we have 5 files, and the system has so many features. One of the featuring is minimal invasive shaping. Every file has a fixed taper and variable cross-section. You can see that every file, not just every, we have 2 blue, 2 gold, and 1 silver, but in every file we have different nickel titanium phase. 𝗏𝗏𝗏 system is very powerful because the files have specific cutting angles to improve cutting efficiency. It is very effective because with these files we have maximum debris removal, and very important for obturation is to have a good comb fit, 𝗬𝗶𝗀𝗃 comb fit, and because of special design the apical portion, we have really perfectly 𝗬𝗶𝗃𝗃 comb fit. This is very important, not just for cold obturation techniques, but when we use the warm compaction or something else obturation technique with a warm 𝗬𝗶𝗃𝗃, it is very important to have a good apical matrix. One of the featuring is a variable cross-section file. This is very interesting because instead of having the same shape from the tip to the handle, these files change their cross-sectional geometry at different points along the instruments. This design increased cutting efficiency in the apical third and improved flexibility in the coronal parts. I will give you an example. This is not the cross-section of the rising system, but I just want to give you an example how it looks. You know, 3 different cross-section or maybe 2 different cross-section, but you can repeat one. And how variable cross-section improve performance of the file. At first, specific cross-sectional shapes increase the cutting efficiency and increase the cutting area, making the file more effective. An off-center or triangular design can reduce stress, concentration to the file. And the very important is the variable design contributes to the file's ability to navigate and shape the complex anatomy of root canals while preserving tooth structure. Okay, in this system, rising system, we have 5 files. The first file is orifice shaper, RR file number 17 and taper 10. This file we're using for coronal prefurling. It is very nice, very effective, a very specific file with semi-active tip. And because of that, in some cases, you can use the error file for starting of retreatment. This is not retreatment file, but because of semi-active tip, you can start the removing 𝗬𝗶𝗃𝗃 in the first phases of retreatment tree. After error file, we have next file. This is glide path file R1, the number 13, and the taper 3. You see that we have a gold file with a very specific heating treatment, and it is very soft file, and because of that you can pre-bend this file. But very specific is that inside of the canal, this file can change their, stability, their stiffness according to the shaping procedure. The file is very soft, you can pre-bend, Martensik file, but if you through the canal go to the calcificating part, then this file became stiff, and you can go through the canal reaching the working gland. The next file is R2 file number 25, taper 4, and you see the blue color, the blue phase, and this is the first file with which we can finish our preparation. Apical design is very specific, and we get a good apical matrix, and you can finish with the R2 if the finishing criteria is fulfilled. And the finishing criteria is fulfilled whenever 3 to 5 millimeters of the most apical fluids of R2 or any finishing file are fully loaded with dentin. If the apical fluids are loaded with dentin, that is visual evidence support that the shape has been cut and then we can finish our preparation with this file. But if the fluids are not loaded with dentin, we can go to the next file. Next file is the R3 file, number 13, and the taper 4. We see the file made by the gold, wire, and this is the file in the most case. This is in the most casing finishing file. You will see. But sometimes, if your fluids are not loading enough with the dentin, you can use the next file. This is R4, very specific file, 28 number, 5 taper. And this file called passage file. Why? You can use this file after R3, but sometimes you can use this file before R3 because the R4 is more flexible than R3. If you have some premolars, some narrow, some canals with curvature, after R2 you can use R4, and after R4 you can use R3. It's very important to say that this specific system, rising system, can't match with the ordinary 𝗬𝗶𝗃𝗃. You need to choose specially designed 𝗬𝗶𝗃 for this system. And the name of 𝗬𝗶𝗃 points are matching with the files R2, R3, or R4. If you finished your preparation with R2, you will choose R2 𝗬𝗶𝗃𝗃. If you finished with R3, you will choose, of course, R3 or R4 𝗬𝗶𝗃𝗃. All files from the system use the same speed and torque control. This is very speedy system, 450 RPMs, and 2.5 Newton is the torque control. And I need to say, the rising is really unique, is really powerful, is really effective. And due to the variable cross-section and specific nickel titanium phase in every file, rising files can be promoted as the longer durability files. I can't say to you how many times you can use these files, but I just want to say the specific of the system is longer durability. Okay, I now give you some protocols how to use this system in different canals. If you have easy canal, straight canal, single rooted, without curvature, premolars, you have some steps. The first steps for me is always canal negotiation. Maybe sometimes you can see on some protocol that first start with the rotary preparation of the coronal pre-fluorine, and after that you do negotiation. No, it's very important. The first step is always canal negotiation with a hand file, with a small C10 hand file. You need to use watch winding motions. You need to pre-bend this file and go to gentle advancement. And after negotiating the canal, you need to know what is in the canal. You need to have some information about length, about wide, about curvature, not just mesial or distal curvature. You see that curvature on X-ray. No, you need to sense, does the canal has, the oral or the buccal curvature? Can you find some calcification or some obliteration at the canal? You will see everything if you negotiate with a C10 file first. After negotiation, we go to the first step or second step. This is coronal pre-fluorine. Coronal pre-fluorine, we do this with RR file, and motion is continuous rotation, speed is 450, and torque 205. The objective of the coronal pre-flaring is to enlargement the coronal third and to facilitate straight line access to reduce coronal interferations. After pre-flaring, we have next step, working length determination with apex locator and C10 file or K10 or K15 in some cases. After irrigation, we go to the glide path preparation, but in the easy canals, we do this with R2 file because we have wide straight canals and we can shape with R2. We use very gentle in and out motions. It is very important to say that the motion of the, using the rising file is a gentle in and out motion. After R2 file and after irrigation, we can go to final shaping and finishing with R4, and R4 is 2804. Motion is gentle in and out, and the objective is to get final enlargement and preparing some canal for the obturation. Very important is underline again that you need specific 𝗤𝗄𝗃𝗃 point, R4, and then you need to verify apical fit and tuck back before the obturation process. If you have medium canals like premolars, molars, or canals with a little curvature, then after negotiating, after coronal pre-flaring and working length determination, you will use R1, the gold R1 13.3 file for glide path to reach working length. And after a lot of irrigation, you will finish your preparation with R2 file. And of course, you will take R2 𝗤𝗄𝗃𝗃 cone, and before the obturation, you need to verify the good tuck back and the good apical matrix. If you have moderate canals, and this is maybe the most frequency used, the protocol, you can start with the negotiation. After that, coronal pre-flaring. After that, working length determination, glide path with R1, shaping with R2, and then you can finish your shaping your instrumentation with R3. I said again, the gentle in and out is motion you can use with this file. And after that, you need to take R3 specialized 𝗤𝗄𝗃𝗃 point. If you have hard cases with severe curvature or calcification cases, then you go through these same steps like in the moderate canals, but you can choose the finishing, the final shaping step. You can choose between R3 or R4. Remember, the R4 is more flexible than R3, and the motions are gentle in and out motion. But sometimes, if you have some calcification and you can reach the full working length with this gentle motion, you can use pecking motion, and you need to activate your hand. You need to help the file to reach the apex. And again, I need to underline, please choose the right 𝗤𝗄𝗃𝗃𝗃 point. R3 or R4 if you use one or second file. If you have very complex anatomy, canals with an extreme curvature, with double curvature, C-shaped canals, then you need to use all the files. But R4 file, you will use, this is passage file, you will use before the R3 because there's flexibility. And that was the old protocols about the different types of canals. And now I will show you this on the resin moulage. At first, I negotiate with a, you see, wine watching motion. And after that, I use RR 1710 file in continuous rotation, speed 450, and torque 2.1. Very nice. You see the fluids are very loaded with resin in this time. And after that, I do irrigation with irrigating needle. Now is the phase of working gland determination in vitro, you know, because you need to see tip beyond the apex. After you need to remove 150 millimeters, and that was the working gland. The next file is R1 file, gold wire, and after glide path management, we need to use the first shaping file, R2 file, 25 number for taper. You see the gentle in and out motions. And after, I will finish my preparation with the next file, with the R3 file. I said in the most cases, I will finish my preparation in this file. This is 𝗬𝗶𝗀𝗃, the specialized R3 𝗬𝗶𝗃𝗃. And you can see good tag back, and you can see that I can't push my 𝗬𝗶𝗃𝗃 beyond the apex, the good apical matrix. And now the same, but for the extracted tooth, upper premolar, with very interesting morphology. You know, in the buccal root, I have two canals, narrow, calcificated. And the first phase is negotiating. I use C10 for buccal canals. I use K15 for buccal. The first file for coronal pre-fluorine, orifice shaper, RR. You see the fluids are loaded with dentin, very sharp, very effective file. I repeat, semi-active tip. I do not show you the phase irrigation between every file, but of course, we need to irrigate between and after every file. This is glide path management with R1 file, 13-3 taper. Very nice, very smoothly, see, gently in and out motion. The first file of shaping, R2 file. I try to reach working gland this very easily because the file is very, very effective because of the angle, cutting angles, and because of the, grooves for maximum debris removing. And I want to show you this. I use passage file R4 before R3 because I have two canals in the one root. I have narrow canals, and now I choose the more flexible file for shaping this root anatomy. I will finish my instrumentation with a R3 gold wire. You see, very easy, very smoothly. And fluids are loaded with dentin, and I finish my preparation. You can see the cone fit, very nice. The three 𝗬𝗶𝗃𝗃 cones. Nice. And now I will start with a clinical case. At first, you see the tooth 46, first right lower premolar, with diagnosis of irreversible symptomatic pulpitis. The first phase is after, of course, excess cavity, do the excess cavity trepanation, negotiation. Now I do coronal pre-fluorine with the RR file. You will see the flutes are full of dentin, you see, very effective file. You see some pulp tissue from the distal canal. This is lower molar, first lower molar with ordinary morphology, you know, have one distal and two mesial canal in one mesial root. And you see the flutes are full of debris. After this phase, I do the working gland determination and I use the K15. Of course, after every file, it is very important to irrigate with sodium hypochlorite. You choose your percent according to your skills, according to your work, but it's very important to use sodium hypochlorite and for the finishing irrigation, sodium in the combination with EDTA. The next phase is glide path management. After working gland determination, I use R1 file, specific, very soft file with very nice. You can prevent this file if you work in the curve, in the canals with a curve. But I said already very specific because if you find some calcification or the file became stiff, you know, stiffness. And you see the flutes are very full of dentin, very, very efficacious and very good file. The speed is 450, the torque is 2.5. After glide path management, I do a lot of irrigation and I use the next file. The next file is the red file R2. I just want to show you irrigation. You will see a lot of debris. Very good and very effective file, R1 file. Okay. Next file is R2. I'm very sorry because I don't have good position on the screen. I saw on the microscope, but my position on the screen is not so good in this file. But I just want to show you the gentle in and out motion. And in this part, you will see the pulp tissue. You will see the pulp tissue because we do the vital extirpation. After irrigation, I finished my instrumentation with R3 file, the gold wire, the special heating treatment file, flexible enough and hard enough, you know, for everything. The variable cross-section enhance the effectiveness of the roots, and you can see the finishing criteria. The flutes are fully loaded of dentin, and I finished my preparation with this R3 file. Very speedy system, very flexible, and very nice. Okay, after just to see, after shaping of 3 canals, I do irrigation, drawing with paper point, the specially designed paper point, R3 paper point, and then obturate this tooth with biceramic sealer and R3 𝗧𝗵𝗽𝗀 points. Okay, the next case is first left upper molar, 226, with diagnosis of irreversible asymptomatic pulpitis. It's very important in this case, after, of course, negotiating, I use error file for orifice shaper for coronal pre-flaring. After working length determination, I use R1 for glide path. Then I use the first shaper, R2, 25-0-04 taper, and I finish my preparation with R3 file. This is the protocol that I use in the most cases. And you can see the very nice lateral portion of exit on palatal, canal. And it is very, very nice and very important to say that a rising system is unique because you can use these files in so many ways. This is hybrid system. In some cases, you can choose to use this system like single technique. You just need to use RR, orifice shaper, and after that you can use R2, for finishing your preparation. This is single technique. One file for coronal pre-flaring and one file to final shaping. Okay, sometimes, like in this case of upper premolar, for palatal canal, I use 3 files. I use RR for coronal pre-flaring, I use R1 for glide path management, and I use R2 for finishing, and I use R2 𝗧𝗵𝗽𝗀𝗀. But in the buccal route, I choose to use simultaneous technique. This is some of kind of a crown down approach where every instrument in the sequence is used to the full working length. And we need to use first small instruments, and the goal is to leave the tip free, avoiding torsional stress and avoiding separation, binding and separation. And for this, we need to have specific, metallurgy advanced files. And rising system is that kind of file. You can use it like a hybrid system. And of course, after obturation, you can see one advantages of this system. This is so lovely lateral portion of exit. Thank you very much for your attention. I hope you will use and you will like rising system, and thank Fanta for introduce me and call me to be a lecturer today.